Hello, I'm Dr. Deigni. We're going to practice saying my name. I'm originally from Côte d'Ivoire, and French is our national language, so we got a French influence going on here. I'm sure you guys will get it. Deigni, Dr. Deigni. Let's say it one more time. Dr. Deigni.
Welcome back to Great Day. My next guest says her plastic surgeon has the most impressive bio she has ever seen. It's the reason she chose him to nip, tuck, and lift a few trouble spots. Terry Voigt is with her husband, Jim, and Dr. Olivier Deigni is back with us, and he is the head of Deigni Plastic Surgery. All right. Okay, speaking of that, this right here is like, this is like, you did your homework, didn't you?
Yes, I did.
You were like, I want to make sure that this person here has, and it goes on and on and on. And we'll talk a little bit more about what's in that resume.
Yeah, exactly.
Yes.
In specific instance, she didn't have a tummy tuck. We did liposuction. She came in, just liposuction. She came in and told me, I want aggressive liposuction, and she really stressed aggressive. So she wanted every little bit of fat cell taken out.
Yes.
So that's what I did.
Wow, that's how you got that flat tummy, and then of course on your back too. That back,
Yes,
that's
well.
the hard
back
part
was
to like.
dramatic.
It's hard to exercise that away right back
Yes.
here, and so you can just go ahead and
And the love
spot
handles.
reduce, and that's the way to spot reduce because we can't exercise and spot reduce.
Exactly.
All right, and then moving on to you take care of breast as well. We know that a lot of women just sometimes it's a lift. How do you determine whether we need a lift versus an actual reduction and the whole bit?
Yeah. So again, it all comes down to physical examination. So you come in. Usually with time, the breasts tend to drop. You lose upper pole volume, and then the nipples actually start pointing down and they sag. At that point, you do need to lift.
Yeah.
And so if you want to restore more upper pole volume, we recommend using an implant as well. And so we combine those procedures as an augmentation, mastopexy, breast lift, and a breast augmentation.
You have that, and then of course there's all types of other things that we can do today in terms of just the fillers in the face, things that just make you look youthful. You're not trying to reinvent the wheel. You just want to make somebody look fresher.
Fresher, exactly. And so our lovely patient here, she did have some of that. She wanted facial rejuvenation, and we decided to use fat grafting for that. So some of the fat that I was able to harvest from her body, I injected in her cheeks and in her jawline and around her lips as well to really give her a nice fuller face.
And then of course the other thing too is not only the resume but how a doctor treats you. How was that whole situation for you?
Oh, just fabulous. Fabulous. He's just like a best friend. I mean, he's just so down to earth.
I always say, if you're going to have some best friends, have a lawyer and a plastic surgeon in the family, right?
Dr. D is fabulous, and he listens to you.
And with this,
All right, good morning, everyone. Today we have a very interesting case. We're going to be doing a liposuction, some body sculpting, medial thigh lift, a breast augmentation, as well as a breast lift, and a tummy tuck.
About a year to basically figure out what I wanted to do with my breast augmentation. I researched myself into a frenzy, saw probably about 4 plastic surgeons prior to Dr. Deigni. I was very thorough in my process, but I just never found the right doctor until I was referred to Dr. Deigni from, I forgot her name, the other nurse. But anyways, she told me about him. She just raved about how just personable he was, how kind he was, and how good his work was. So I was like, okay, I'll give it a try. I came in, the process was very smooth. He was very personable, answered all my questions, and just guided me through the process. He listened to what I wanted, and the results, I got to say, are exactly what we discussed. Everything turned out actually better than I thought, because after having conversations with other doctors, they weren't telling me I, just what I needed to hear. I actually left one crying, so coming to Dr. Deigni was a very, very good thing for me because it gave me that peace of mind because it took me over a year, like I said, to figure out and who I wanted to do it with. Very happy with the results. So much so that I came in and sought lip fillers. Again, very nervous, but because it was Dr. Deigni, the process was very smooth. And I love the results as well. So I definitely will continue to, follow up with Dr. Deigni if there's anything else that I'm interested in. And I will continue to send people to him because he just has that touch.